Welcome. My name is DJ Quinlan. I'm with Protect Our Care Arizona. And first of all, I'd like to welcome everybody who's watching either over Zoom or Facebook Live. This is the Protect Our Care virtual bus tour. As you can tell, there's no actual bus involved this year due to the health condition that our country is currently facing. But it's really important that we're all here today, and we've got some amazing speakers that are going to highlight how healthcare is really the defining issue of the 2020 election. The Protect Our Care bus tour is going to 16 key states all across the country. We're here in Arizona today on October 6th, a really important time. Tonight, we're going to have our two U.S. Senate candidates face off in a really important debate. And we've seen healthcare really be the center of that race, as it has been the center of so many of these electoral races across the country, but really key here in Arizona. Also tomorrow, Arizonans will actually start voting early. Folks who vote by mail will actually start receiving their ballots in their mailbox, as early as Thursday or Friday. So this is just really key timing, and we've got great speakers today who will kind of highlight why healthcare is so important and what is really at stake. We've seen the Trump administration engage in a level of sabotage toward the ACA that has been continual since he's been elected. And now, 1 week after Election Day, we could see the US Supreme Court basically overturn the Affordable Care Act, which would be devastating for Arizona in terms of eliminating key protections against pre-existing conditions and the loss of healthcare for hundreds of thousands of Arizonans. We are privileged today to have a welcome video from Captain Mark Kelly, which I'll share right now, and then we will go into our speaking lineup.
Hey everybody, it's Mark Kelly. Hey, I want to start out by saying thank you for the important work you're doing to protect access to affordable health care for families across our country. The work you've done to defend protections for people with pre-existing conditions is critical, especially now. But as you know, that work is just beginning. There's so much on the line this year, like lowering the cost of prescription drugs, protecting Social Security and Medicare, and getting our economy back on track. And these issues affect nearly everyone. As I've met with Arizonans over the last couple years, time and time again, I hear about the ways that our healthcare system continues to fail our families. I hear from folks like Ophelia, who had to choose between paying her month's bills or buying the medication she desperately needs. I've talked to people like Matt, who was only able to get the healthcare he needs because of protections for pre-existing conditions. But he worries that his life will change in the blink of an eye if those protections are rolled back. We have to do better, and we can do better. Our country has always come out of tough times even stronger, and this year is no different. We have to lower the cost of healthcare and prescription drugs to make it affordable for all Americans. And we must protect Social Security and Medicare so our seniors can retire with the benefits they've earned. And we have to defend protections for people with pre-existing conditions. So thank you for the work you're doing in the fight for affordable health care, and thank you for your support.
So before we get started with our speakers, just a couple of quick housekeeping notes. There will be a Q&A section at the very end of our program, so stick around for that. For folks who are watching via Facebook Live, you can ask your questions as we go along directly on the stream. So please do that, and we will try to answer questions at the very end. Our very first speaker today represents much of rural Arizona, particularly northern and eastern Arizona. Congressman Tom O'Halloran.
Well, good afternoon, everybody. Thank you for being on this. Really appreciate it. Appreciate the time to tell some stories like Mark just did. I have a little bit different story. I was elected to Congress in 2016. I first was sworn in 2017. And my first bill was one on closing the donut hole. I get up to I passed out committee, and I got up to the Rules Committee, and I sat down at my table. And the next thing I know is that the chairman puts 4 bills up on the top of the dais. And we go a little bit into my discussion on the donut hole when he says, hold on a second. You see these 4 bills up here? I see, well, I see 4 stacks of paper. He says, those are the bills that we've been working on and trying to get through Congress to make sure we have a good health care plan for the American people. I said, well, I've never heard of them, and I still haven't heard of them now that I'm in Congress. Now, when did you put them up for a vote? Well, we haven't done that. I said, well, how long has these bills been designed? Well, we've had some designed as far back as 2012. Now this is 2017, so 5 years have gone by. They've supposedly had bills to address this. During that time, they tried time and time again to rescind the ACA. And now they wanted to continue to do that again to the American people. Congressional District 1 is 54% of the states in my district. So you can understand how much rural area there is and people that really count on the ACA and a good healthcare system in general. But if this were to go away, 300,000 people in the state of Arizona have pre-existing conditions. 2.1 million people in the state of Arizona would lose their protection for pre-existing conditions. These are costly and issues that involve life and death situations for many people. 400,000 could lose Medicaid expansion. And I also know that because I represent 12 tribes in the district and the largest population of tribal members out in all of America for a congressional district, that they would lose Indian health care because that's embedded into the system. So this is serious. And I just got off a meeting where I was informed that the president was going to make sure that we continue down a path of trying to do away with the ACA in court. Now, if you're caring about the American people, if you're caring about people, whether they're young or just starting out in life, or just trying to live and collect the not entitlements, to collect what government owes them for their public health through Medicare, a lot of that would go away eventually. This is a serious situation for the American public, for Medicare, the ACA, Affordable Care Act, and for Medicaid. And I know Mark mentioned Social Security. That's on the docket too. This is not about trying to move America forward. This is about moving America backwards. Because if you're going to go after it, have either a better plan or at least have a plan. And they don't have any of that. And so I'm going to leave some time here, I think, or I spoke too long, you tell me. But I'm looking forward to the questions and making sure that we thank you for the wonderful bus trip. It's a rocky road for all the healthcare in this town, but the bus was just wonderful. So thank you very much.
Thank you, Congressman. We're all kind of doing make-believe with the bus this time, but obviously this is such an important issue, and we thank you for all of your work protecting healthcare in Congress. So thank you very much.
My pleasure.
Our next speaker we have from a great organization in Arizona that's doing so much work, particularly in defending access to healthcare and educational resources for children, Children's Action Alliance, Zeta Didoff.
Good afternoon. Thank you. My name is Zeta Didoff. As DJ mentioned, I'm the Director of Health Policy at Children's Action Alliance. As Arizonans, we really remember the Great Recession because our state was one of the hardest hit and one of the slowest to recover. We all knew families who lost their homes and their hope, or their businesses had to shut their doors for good. And we all felt the loss of livelihood that rippled through our cities, our towns, and our communities. We also remember that our state government made some hard choices. They were choices that tore down a foundation of economic and social supports that we and our predecessors built with our tax dollars and set aside for hard times. Over a fifth of the state's Medicaid budget was cut during and in the aftermath of the recession, and hundreds of thousands of Arizonans lost health coverage. Our children's health insurance program, Kids Care, was frozen, and tens of thousands of school-aged children lost access to health care. While our state was rebuilding, the Affordable Care Act provided Arizonans with a literal lifeline. It offered new pathways to affordable, quality health care, protection against discrimination, and investment in the health and well-being of Black, Indigenous, and communities of color that for far too long have been oppressed, abused, and ignored. Now, on the crest of a global pandemic, with the fate of the Affordable Care Act in limbo, the lives of hardworking American families are once again hanging by a thread. The ACA led to significant improvements in access to care for children across Arizona. And we know that decades of research has shown that kids with health insurance are more likely to receive preventive care before it becomes an emergency. They miss fewer days of school, and they're more likely to graduate and pursue higher education. As adults, they earn more money and pay more in taxes. This is all to say that funding programs that keep kids connected to health coverage is an investment in both public health and social justice. The Affordable Care Act has been particularly effective at reducing racial and ethnic disparities in health coverage for Arizona's kids. Latino families in Arizona are more likely to be employed, but less likely to have health coverage through their jobs. So the affordable health care options offered through the ACA, including restoration of kids' care, Medicaid expansion, and the healthcare marketplace, led to a reduction in the rate of uninsured Latino children from 22% in 2008 before the law went into effect to just 10% in 2016. In that same time period, the rate of uninsured American Indian children in Arizona decreased from 35% to 14%. The ACA permanently reauthorized the Indian Healthcare Improvement Act, and in doing so bolstered Arizona's tribal health facilities and rural hospitals. Sadly, since 2016, these gains in children's health coverage have been heading in the wrong direction, and we don't yet know what the impact of the pandemic will be on the rate of insured people in Arizona, but we do know that the Affordable Care Act is more important than ever. Erosion of the Affordable Care Act and cuts to access, kids' care, and the ACA marketplace should be seen for what they are: a direct threat to the well-being of children and families of color in Arizona. For our kids, for our health, and for our future, it's more important than ever that Congress and our state policymakers act to protect our care. Thank you.
Thank you, Zeta, and thank you for what you do as the Director of Health Policy for Children's Action Alliance. We're really happy to have Children's Action Alliance with us today and for all your guys' work. Our next speaker is not only a doctor, but is also a candidate for Congress in Arizona's 6th District. Dr. Hiral Tipirneni was an emergency room doctor for over 8 years, I believe, and we're really excited to have her expertise joining us today. Dr. Tipirneni.
Thank you, DJ, for having me. It's good to be here with all of you, talking about such a critical issue. I'm Dr. Hiral Tipirneni, and as DJ said, I am also the Democratic nominee for Congress here in CD6. And my background is medicine, and that is why I'm here. I mean, I'm running for Congress because of this issue of healthcare. I'm a former ER physician, and in my clinical work, I spent years caring for families and individuals, many of whom came to the emergency department because they did not have access to the healthcare system any other way. I mean, the number of times that I would see a parent with a child that maybe was at home with a fever for several days. They did not have access to a healthcare provider. They did not have insurance. The parent probably couldn't even take a day off for paid sick leave or family medical leave. And they end up in the ER, and the parents are just heartbroken, partly because they're so worried about their child's health, partly because they also don't know how they're going to pay this bill, but they didn't have any other choice. And then they're thinking, how am I going to pay for antibiotics? What if we need any other treatment? How am I going to put food on the table if I get strapped with a bill like this? And it's a lose lose, predicament they find themselves in. And in our nation, that is happening still to this day, and that's unacceptable. The ACA was a huge step forward. We brought now over 23 million people into the healthcare system. And the cornerstone of that piece of legislation is the protection for pre-existing condition coverage. Without that, millions of Americans are left either uninsurable or are charged astronomical premiums. This, in our country, we absolutely have failed in achieving that goal of quality, affordable healthcare for every American. We can get there. We have to get there. And it's never been more dire than it is right now. We are in the middle of a global pandemic. We have over 7.5 million Americans who've tested positive for coronavirus. We've lost over 200,000 of our fellow Americans. And we are looking at millions of folks who are unemployed, and many of whom have lost their healthcare coverage. And at the same time, we have an administration, my opponent is part of this lawsuit, trying to rip away healthcare from 23 million Americans, as well as pull back on pre-existing condition coverage. I mean, that's unconscionable. And that goes against every fiber of my being. I've spent my entire professional life solving complex medical problems to try to make a positive impact in people's lives. And that means at the core of it, it's about serving others and being there for them in their darkest and most difficult moments. And here we are in one of our nation's darkest and most difficult moments. And we are trying to fight an administration that is literally trying to take away the remaining safety net that is there for millions of families across this nation. We won't stand by and allow that to happen. We know that there are not only millions of Arizonans that are hanging by a thread, but there are tens of millions of American families that are hanging by a thread. So if anything, this election is about healthcare. Healthcare, I believe it's always on the ballot, all these policy issues, but it's never been more evident than it is now that healthcare is on the ballot. There's a SCOTUS case going up the week after the election, November 10th. I've lost track of time. November 10th, 7 days after the election, this case goes in front of the Supreme Court to fully repeal the ACA. So for everyone out there, I want you to know that healthcare is absolutely on the ballot, and everyone we vote for up and down the ballot, we have to make sure that they are fighting hard, tooth and nail, to protect our comprehensive and affordable healthcare for all of our families. So thank you for the work you all do as Protect Our Care, and to all of the amazing advocates that are here, and to Congressman O'Halloran. I'm proud to be in this fight alongside all of you. It has never been more dire than it is right now. Thank you.
Thank you so much, Dr. Tipirneni, and I agree the stakes could not be higher. You mentioned pre-existing conditions, which affects more than 2.8 million Arizonans and would be devastating if that lawsuit is successful. We've got a couple of speakers today who I think particularly drive home what's at stake. One of them is an alumni of a previous bus tour, Stacy Lynn. Stacy?
Thanks, DJ. And my name is Stacy Lynn, and I am a mother to two children, two daughters. One is 10 years old and one is 12. And I just want to share our experience, which I might add isn't unique to our family. It is the story and the experience of thousands of families in Arizona. In 2009, I was pregnant with my second child. And when we went for what I thought was a routine ultrasound to find out the gender of the baby, knowing that's not what insurance is really covering, is a gender reveal party later. We went for the ultrasound where the ultrasound tech was checking the organs and the heart and the spine and all of those things. And during that ultrasound, the tech became really quiet. And I knew in that moment that something was off, something wasn't right, but I couldn't have imagined what happened next. The physician walked into the room and looked at my husband and myself and said, "There's something wrong with the baby's heart." Those were the first words out of his mouth. And we soon found out that my daughter, Zoe, would be born with half of a heart. So the side of her heart that's missing is her left ventricle, did not develop in utero at all. And so the left ventricle is the side of the heart that pumps blood to the entire body. So you may be wondering, like I was, can you survive with only half a heart? And in talking to physicians over the next several weeks, we learned that yes, in fact, you can survive. There's a series of 3 open heart surgeries to reconstruct that half a heart so that it's working and doing the same job essentially as a whole heart, but it needs 3 surgeries in the first 3 to 5 years of life. So Zoe was born in May of 2010 and had her very first open heart surgery at 15 hours old. And she had her second open heart surgery at 4 months of age, and her third open heart surgery at 3.5 years of age. So needless to say, our anxiety over Zoe's survival began mounting when I was just 20 weeks pregnant. And on top of all of the stressors of the very real risk of her not surviving and the long-term consequences of living with only half a heart, were the real stressors and the barriers that our own healthcare system gave us. And Zoe is one of more than 17 million children living in the United States with a pre-existing condition. Private insurance companies place lifetime caps on coverage, meaning once you hit an amount that they have paid out from your plan, they will no longer pay for care. So these caps typically range from $1 to $5 million. And while you might think that $5 million sounds like a lot, it's not, especially when you're talking about the cost of care for a lifetime of medical treatment in the United States. And to put that into perspective a little bit, Zoe's first open heart surgery and hospitalization alone reached $1 million. By 6 months of age, she had had 2 open heart surgeries, and she was dangerously close to hitting her lifetime cap. So if you can imagine hitting your lifetime cap at 6 months of age and having to live out the rest of your life with a chronic illness, it's just not sustainable. She would not be insurable after hitting that cap as an infant. And lifetime caps are one of the hurdles that we were facing prior to the Affordable Care Act. Obviously, Zoe is diagnosed with a pre-existing condition and she wasn't even born yet. So what I always have trouble wrapping my mind around is how we live in this country in 2020, where you can be disqualified from healthcare coverage even before you're born. And now I talk to families around the country that really don't understand that because they've had the Affordable Care Act. I talk to families whose children will be born with half a heart, who will be born with a variety of birth defects that don't even realize what they now take for granted. And I'm so grateful for that. But I have to now educate them on what they could be dealing with and what they could be facing. And I tell them that this election is vital. Millions of Americans' lives and livelihoods depend on the outcome of this election, including Zoe's. The constant threats that we've faced to our healthcare over the last 4 years isn't sustainable for us to survive, nor for us to thrive. Everyone living in today's America with a pre-existing condition is considered less than under Trump's care plan or lack thereof. And everyone with a pre-existing condition in this country, if Trump takes over our healthcare, is considered not good enough. We must stand up to these attacks once and for all and protect our care, especially for the most vulnerable among us. And Zoe and I urge everyone out there to get out and vote, get out and get others to vote. We can't afford the re-election of a man who puts his personal and political interest above the lives of Americans. There is only one presidential candidate on the ballot who will honestly and transparently protect our care, and that's Joe Biden. Thanks, DJ, for having me share Zoe's story and really the stories of so many Americans out there that live with a pre-existing chronic illness on a daily basis.
Thank you, Stacy. And Zoe's such an inspiration, and it's always a great reminder to hear the story about really what's at stake in this upcoming election. The stakes just really could not be higher, and 2020 is most definitely going to be a healthcare election. Our next speaker works for a group that all of us in Arizona are familiar with. They do amazing work in a variety of fields, including healthcare. Chicanos por la Causa. Lydia Guzman is the Director of Advocacy and Civic Engagement for CPLC, as we call them. And we're very happy to have her here today. Lydia.
Thank you, DJ, and thank you so much, panelists. Stacy, I was so moved by your story, and I'd like to share that Chicanos por la Causa, we do help lots of families. Last year alone, we were able to impact over 620,000 individuals. This was last year prior to the pandemic. Now that the pandemic is hit more than ever, our families are struggling. It's no secret that the zip codes that are most impacted by the pandemic are the zip codes where our Latino families are living. It's the zip code with the highest contagious, the contract rates. It's they're the ones that are essential workers. But many of those essential workers are losing their homes, they're losing their jobs, they're the ones that are affected by this coronavirus. And as a result, what they're doing is they're reaching out to organizations like ours, Chicanos por la Causa, and we can certainly help them through funding from the CARES Act for things like, for utility assistance and rental assistance. But what we cannot do is help them with coverage for medical insurance. And this is so important because we know that if it weren't for the ACA, many of them would not be able to still continue to have coverage. A lot of our families in our Latino communities do have pre-existing condition like other minorities. Our African American brothers and sisters, our Native American brothers and sisters, Latinos have a high propensity for being diabetic, and in the eyes of many insurance companies, that's a pre-existing condition. And that is one of the biggest factors that also affect COVID. Unfortunately, we have lost a lot of our friends to COVID because of this. It is important right now, more than ever, that we do as much as we can to educate our people of color, our voters of color, on the importance. We know that when we talk to Latino voters all across the board, a lot of the issues that were important to us were education, jobs, healthcare, but more and more lately, the top thing that is important to every single family right now is access to healthcare, access to health insurance. And this is why the Latinos we're doing a campaign. We're educating our voters to say if healthcare is on the line, what we're voting for is access to healthcare. What we're voting for, what's on the ballot, is the basic protection. It's a basic human right, healthcare. And that's what's on the ballot. And when we talk to voters, all they have to do is listen to the candidates that are talking about protecting the Affordable Care Act, protecting to make sure that our children have that same access. And so, our families, we the Latino families, it's interesting that we don't have the highest wages in the community. We are amongst the lowest wage earners, and as amongst the lowest wage earners, we need to ensure that the healthcare that they're purchasing is also affordable. And this is why we need to protect the Affordable Care Act. In order to protect all those families with all of our children, we have to make sure that we do that. I'm going to stop there because I know that I want to make myself available for questions. But thank you so much, everybody, for allowing me to be a part of this panel.
Thank you so much, Lydia. And it's such a great reminder of how COVID and how the ACA particularly affects the Latino community. I know if for instance, the ACA is repealed, 400,000 Arizonans will lose their health care, but 200,000 Latinos in Arizona could lose their coverage, 214,000 actually to be exact. So it is obviously a disproportionate effect within that community, and we really appreciate the work that CPLC does, as well as your work. Our final speaker today also, I think, really drives home what's on the line in this upcoming election. She was born and raised in Arizona and has become kind of one of the preeminent advocates for how the nation is responding to the COVID-19 pandemic. Kristin Urquiza. Kristin?
Hi, everyone. Thanks for having me here today. It's so good to see and hear from so many incredible advocates in this space. As DJ said, my name is Kristin Urquiza, and I am the co-founder of a new organization called Marked by COVID. Marked by COVID has been working with families all across the country, but with a strong hold of families in Arizona to help uplift stories of COVID loss, COVID survival, and COVID workers, folks that we have lost, as well as people that we stand to lose because of our response to this pandemic. I launched this organization just a handful of days after I lost my own father, Mark Urquiza, to the pandemic. My dad, Mark, was born at St. Joseph's Hospital. He spent most of his childhood in Tolleson, and my mother and he lived their entire lives in Maryville, which is where I grew up and where I still go back to for holidays. My dad, he was a supporter of the presidents. He was also a supporter of Doug Ducey. Whenever the state reopened in May, and both went on a spree trying to convince us that we were safe, that it was safe to be out and about if you didn't have underlying health conditions, that we were on the other side of this pandemic and that it would be no worse than the flu. Folks like my dad listened and thought it was safe to start going back out and resuming normal activities. Within a couple of weeks, he contracted the virus, and then sadly, after a 19-day battle, he passed away. The reason why I've decided to join this bus tour and be such a vocal advocate on the issues of healthcare is that there are so many people in this country who are experiencing what my dad experienced, from misinformation about practical healthcare measures to protect themselves and one another, to believing in weird remedies that are being promoted by folks in leadership positions. Access to care and quality information is incredibly important. And that is exactly what's on the line this election season, is not just our basic healthcare, but sound healthcare information. Over the course of the last several weeks, it's been very difficult for folks who've been impacted by COVID. The events over the course of the last couple of days are no different. I myself was in Cleveland as a guest of Vice President Biden at the last debate, or the first debate that we just saw. I was at that debate as a guest. I was told that there would be everybody would have a COVID negative test, and that everybody would be wearing masks. Once I got there, I learned that that was not the case. So I just leave you with this. People's lives matter. The information coming from leaders matter, and our healthcare is on the line this election cycle. Thank you so very much for having me here. While I don't currently live in Arizona, it is my home. It's where my family lives, and it is where I will always call home. Thank you.
Thank you, Kristin, and we'll always claim you. So thank you for joining us today and for your remarks and your advocacy and your wonderful work. We are now entering the Q&A portion So I'm going to hand it over to Kelly Reimar from Protect Our Care, who will explain the Q&A process.
Yeah, thank you, DJ, and thank you to all of our panelists and for everyone who has joined us via Zoom and via Facebook Live. If you have a question for any of our panelists, please go ahead and enter that into the Q&A chat box at the bottom of the Zoom screen. Or if you're on Facebook Live and would like to ask a question, you can go ahead and leave your question as a comment on the live stream, and we will do our best to field incoming questions. The first question we actually have coming in is a question about pre-existing conditions, protections for pre-existing conditions under the Affordable Care Act. The question asks, Republicans like Senator Martha McSally claim to plan to protect pre-existing conditions, but they continue to attack the Affordable Care Act. This question isn't directed at anyone, but we're wondering if someone can respond to claims that Republicans will protect people with pre-existing conditions while working to overturn the Affordable Care Act.
I'd like to comment on this one, if I may. So they're saying that they're going to protect pre-existing conditions, but the point is it has to be affordable. And that is the difference, is that you can sit there and say, well, you know what, if you have asthma, don't worry, we'll cover you, but we're going to charge you this astronomical premium, right? So it's a matter of making sure that insurance companies cannot charge you more for that pre-existing condition. It's not just to say you have protection, it's that you can't be charged more, that you can't be penalized. It's just like making sure there's no gender penalty, right? No gender tax, no age tax. It's the same thing, not being penalized for having a pre-existing condition. So that is a falsehood that she is putting out there, because it would not be an affordable option. And it has to be very clearly stated that the only folks that are fighting to protect the AC or protect pre-existing condition coverage are the people who are fighting to protect the ACA.
And I'd like to just comment about the fact that, you know, it's not what you say in an election year, it's what you do over the years. And I haven't seen anything out of the current senator that would indicate otherwise, that she would not protect the system. There was time and time and time again for her to be able to stand up and do that, and she failed the test.
Yeah, thanks, Congressman. I would also note, you know, I think we even saw today a brand new television ad from Senator McSally claiming that she's always protected pre-existing conditions. However, as the Congressman mentioned, when you go back and look at her votes, whether it was the 2015 vote to completely repeal the ACA with no replacement, which would have devastated Arizona, kicked hundreds of thousands of people off of their health care, and completely eliminate the protections on pre-existing conditions, to her 2017 vote for the AHCA, which did not offer the protections for pre-existing conditions that Arizonans are so reliant on. So, you know, I agree with the Congressman. I think it's really more about what folks do when they get to Washington, and not their campaign promises.
Thanks, DJ. And this is just another reminder to folks who are joining us on Zoom. If you have a question for any of our panelists, please go ahead and enter that question into the chat box via Zoom. Or if you're joining us on Facebook, please go ahead and leave any questions you have as a comment on the live stream. We do have another question coming in, and this question is for Kristin. Kristin, this question asks, if the Affordable Care Act is eliminated in November, how could Arizonans who survive COVID-19 and are suffering long-term health consequences be affected? And what does that mean for their access to care moving forward?
I'm happy to jump in and give what I know on this, and then invite others who might have a little bit more background on the particulars. To the best of my understanding, if the Affordable Care Act is abolished, we are entering into dangerous territory that could mean COVID survivors. COVID survivors are labeled as having a pre-existing condition. One of the things that we need to ensure is that every single person who has contracted COVID has the care, the long-term care that they need to be able to get out of this situation in the long haul. Part of the thing that terrifies me, as well as so many people that I talk to, is wondering whether or not there is going to be a long-term health implication that they're not going to be able to afford. What if they need a lung transplant in 6 or 12 months because they have had a severe case or something else that we don't know yet? Protecting the Affordable Care Act and building on that is one of the most important things that we need to do to ensure the basis of care for COVID survivors. And I welcome others to add in on that too.
You know, I'd like to say that many of the survivors that we have come in contact with, um, have complained of other complications. And I know that the doctor could probably attest to this, but the reports are coming out more and more that there are long-term implications on this. There's all kinds of organs that are being affected by this. And because this is so new, we are still learning so much. But I know that in our communities, the ones that are coming to us are not only having effects that are going to carry them throughout their lifetimes, but we're talking about, besides the pre-existing condition, the ongoing medical care that those families are reaching out to us and say, what am I going to do? Now, more than ever, I think the Affordable Care, the ACA really needs to consider all of those survivors that are going to be affected long term. And a lot of them are in our communities are going to need this continual care because we're still learning. We don't know what we don't know. But what we do know is that we have millions of people that are going to be affected. So I just wanted to throw that out.
Those folks are identified as long timers. And right now, there's a smaller amount known about that process, but there's also statistically not maybe in the hundreds right now. It's going to go higher and higher and higher. And it's going to become more difficult and more costly. And so any one of those individuals that without ACA is not going to have that guarantee that there's not a limit to how much is going to be available to them to fight what's occurring. And this is through no fault of their own. And then the second piece is obviously we as a government, we as a country, we as citizens that come together have to make sure that this does not destroy not only that individual, but the families that depend on them. And so this is a real issue, and we still don't know everything we need to know about this dreaded disease.
Yeah, and the only thing I would add to that is that, especially with our younger populations, right? I mean, we've seen for the most part a lot of kids who don't have, for the most part, again, don't have real serious, courses of their infections. But what we don't know is what the long-term consequences may be. Could there be long-standing damage that only, comes to show itself once they're older, once they're larger in size, they have larger lung capacity, more demands on their bodies as their metabolism increases as they're growing in their teenage years and so forth. We don't know how any of this will be cause for compromise of their respiratory system, their cardiac system, and so forth. So and that's the other thing, right, with insurance companies, if we don't have these protections, is that they can literally try to draw a line from anything back to, right, and say, well, we don't know that this isn't from COVID, so sorry, this is a pre-existing condition. And this is a historical practice, right, of insurance companies, certainly before the ACA. And it is absolutely something that would make millions of Americans vulnerable if they lost the pre-existing condition protection coverage, because you could virtually take any complaint you'd have down the road if you were infected, and they would find a way to somehow tie it in if they could. So this is the cornerstone of the ACA that we actually absolutely have to protect.
Great. With that, I just want to thank all of our panelists for an amazing program and for all of your work. One thing that is just crystal clear is that 2020 is going to be a healthcare election. There is so much that's at stake and on the ballots, whether it's about our response to COVID-19, protecting the ACA, strengthening the ACA, protecting Medicaid and our access system here in Arizona. There's so much that's just so important. So we're going to wrap it up. And again, thank you for everybody who joined and for everybody who asked a question. And have a great, wonderful day. Bye.